Endolift. What is Endolift? What can I expect with Endolift? Endolift Results. Endolift Cost. Is Endolift worth it? Am I a candidate for Endolift? I wanted to do a video dedicated especially to Endolift because I've gotten so many questions in comments on my YouTube channel and on my Instagram and in the office seeing patients about this procedure. So let's take a deep dive into Endolift, and hopefully after watching this video, you'll have information that can help you determine whether Endolift would be a procedure that would be right for you with the results that you can expect and if you're a good candidate for this procedure. So are you ready? Let's get into it. So my name is Dr. Stephanie Kappel and I'm a board certified fellowship trained procedural and cosmetic dermatologist. I have a private practice in Newport Beach and I see patients every day, hundreds of patients each week, and I provide these non-sponsored educational videos for you on YouTube so that you can make better informed decisions for yourself and for your skin to look your very best at every age. So click subscribe and hit the notification button so that you don't miss a video each and every week, because I do these educational videos again for you guys to make better informed decisions without sponsored content. I'm not an affiliate with any company and just want to give you true and honest information that's backed by science and evidence-based medicine as a board certified dermatologist. So Endolift is a procedure that I get asked about all the time, and I wanted to do a video dedicated just to this one procedure because I get asked about it so much. Now, as a laser specialist, I have almost every laser that you can think of, energy-based devices, tightening devices, skin tightening procedures, but I actually do not have an Endolift in my office as a device. But that doesn't mean that I'm not in support of it. That doesn't mean that I don't think it works, but I think that for the right patient and for the right person who's looking for a certain result with a certain skin type, it may be a very beneficial treatment, and I'll get into why. So hopefully, again, after watching this video, you'll learn a little bit more about the procedure, and not only about Endolift, but the mechanism of action in which this procedure works, because that is of utmost importance, because mechanisms of action which will induce skin changes to give you the result that you're looking for may not stop at Endolift. There's lots of other different procedures that can use radio frequency or laser or other forms of energy to stimulate collagen, to reduce fat, and understanding how these devices work will keep you educated and informed so that you can make better decisions, not only with Endolift, with other procedures too that may come along in the future, or the works right now in an FDA trials that get launched in another couple months, and you'll understand how these devices work so that you can make informed decisions. Hey, is this right for me? Oh, I understand how that works now. Am I a candidate for it? So instead of having marketing flooding your YouTube and your cell phones and your different devices that you use to look up information, I want you to know how these procedures work and decide if they are right for you or not just by some influencer, telling you with marketing that you should use this device because they use it and they've gotten this result. Because half the time out there, it's the Wild West, and half these influencers or doctors who are proposing these treatments aren't using them in their office or aren't using them themselves. They're just getting paid to say that they do use them. So I think it's really, really important to have honest and true science-backed, evidence-based medicine and education and videos like this so that you can make informed decisions on if a procedure would be right for you. So what is Endolift? Endolift is a minimally invasive skin tightening and fat reducing procedure that is done in the office without surgery. So there relatively is minimal downtime when compared to something more aggressive like surgery, and the results can be either underwhelming or pretty amazing depending on what you're looking for, what your skin type is, what type of aging process that you're undergoing, your age, and many different factors that can play into it. So using a laser-based wand on a cannula that gets inserted into the skin, usually face and neck are the most commonly areas treated, but you can also use it on skin laxity in the inner arms, on the abdomen, on the inner thighs, and other areas of the body as well. But the mechanism of action in which it works is by temperature. So you have to understand how temperature affects the skin, and you have to understand the different subcomponents of the skin. You have the epidermis, and then the next layer where all the collagen and the extracellular matrix proteins are, which give us that beautiful, plump, juicy, bouncy skin, especially when we're younger, because it's chock full of extracellular matrix proteins like collagen and elastin and glycosaminoglycans. That is the meat of the skin that is usually the target for anti-aging procedures. And when you heat up that area of the skin, which we call the dermis, it stimulates the fibroblasts, which are collagen producing cells, to make more collagen and elastin. And collagen and elastin gives skin that beautiful, firm, tight, smooth turgor. And that's what we're always trying to induce in patients who have lost elasticity or have had aging, occur in their skin with a little bit of laxity and fine lines and wrinkles, and we're trying to get that back. Now, when you look at the dermis, there's two components of the dermis. There's the papillary dermis up at the superficial area and the reticular dermis, which is down beneath underneath, and then below that is the subcutaneous fat. Now, skin is highly responsive to temperature, and temperature changes can be induced in the skin by lasers, by radio frequency, monopolar, bipolar radio frequency, by different, by cryolipolysis, where we actually lower the temperature in the setting where we want to decrease fat or, reduce adipose tissue. So by putting different temperature ranges in the skin at different levels of the skin, say you're in the dermis, you want to stimulate collagen, you want it hotter. Say you're in the subcutaneous tissue where there's fat and you want it cooler, you want less fat, more collagen. Or say you're in an area where there's extra fat like the jowls or the submental area where the double chin is, you'll want to melt fat in those areas. So it's very, very important to be very cognizant and very particular with temperature ranges, understanding those temperature ranges and what they do to the skin. Again, increased temperature stimulates collagen, but too high of a temperature can decrease fat, which sometimes you want, but sometimes you don't, right? Sometimes you want more fat in the face, but you want less fat in the double chin area. So it's really important to understand these temperature ranges, how to get the energy or the temperature in those ranges specifically to stay in those areas to induce the histological skin changes and subcutaneous changes that you want for the results that you're looking for. I hope that's not too scientific, and I hope that makes sense. So Endolift uses a thin fiber optic scope and probe that goes underneath the skin and a little insertion point which gets numbed up with some local anesthetic, and it kind of gets threaded through the skin in the skin layers or the subcutaneous layers or the intradermal layers to either induce collagen stimulation to tighten skin or to reduce adipose or fat cells to reduce fat. So the laser wavelength is 1470 nanometers. Now in laser medicine and as a laser specialist, I talk in parameters and laser settings, wavelengths, spot size, treatment, affluence. So when you're, expert in lasers, you don't talk about, Endolift or, Fraxel or, you don't usually use the trade names. When doctors talk among doctors, we talk about wavelengths and parameters. So 1470 nanometer wavelength laser means everything to me. Endolift is a trade name, it's like saying, some type of brand name of something, but you really want to know, even like in pharmacology, when you're talking about a medication, you can use a generic name, the scientific name, or the trade name. Most doctors, when we talk among colleagues, we're talking in generic names. We're not talking about the trade name. So Endolift in my head is 1470 nanometers. And what that does is it targets water as the chromophore. Now in English, what that means is lasers are collimated light in a coherent wavelength, which makes them very specific for targeting certain ailments in the skin. For example, V-beam laser is a 595 nanometer wavelength laser that targets redness. Hemoglobin is a chromophore. That's why we use it to treat redness, rosacea, broken capillaries in the face, and facial flushing. You have the 1064 nanometer YAG laser, which targets melanin as the pigment in the skin, as the chromophore. And so that's going to help remove brown spots, hyperpigmentation, melasma, and so forth. So if you look at the graph for what's called the theory of selective photothermolysis. Now, Rox Anderson, who is a pioneer and a giant in the field of laser medicine and dermatology, actually taught me this personally. That just shows you how old I am. But he is the founding father for many of these lasers, and it's all based on physics. It's all based on laser wavelengths. And if you look at the graph, when you look at the wavelength of the laser and what it's targeting, there's different chromophores, which are particulates in the skin that absorb a certain wavelength to which it's targeted. So 1470 nanometer wavelength laser, which is what Endolift is, targets water as the chromophore. And that allows it to distribute heat into the dermis, which is going to stimulate collagen production by the fibroblast cells to tighten skin. It can also be used to absorb water in the subcutaneous area of the skin where the fat is for lipolysis, or to decrease adipose tissue, so like submental area, double chin, to kind of chisel out the jawline and things of that nature. But different areas of the skin need different temperatures, and you wouldn't want to confuse them or mix them up. That's why it's really important to go to somebody who is, very highly trained, because if you achieve temperatures too high in the dermis where you want to stimulate collagen, you actually are going to melt fat in areas that you don't want to melt fat, and vice versa. So it's really important to be cognizant, highly educated, and trained in how the laser physics and device physics works in the skin, and histologically what that looks like under the microscope, so that you can get the best treatment in the targeted area to get the results that you're looking for. So there's a particular window, a temperature range, that you want to have the skin in the dermis to stimulate collagen. Now, anything too high above that is going to melt fat, and that is the biggest fear with energy-based devices. I hear all the time, I'm so afraid I'm going to have, thermage and it's going to melt my fat. It should not melt your fat if your provider knows exactly that window window to be in, because sometimes people who maybe don't understand the way laser medicine, laser physics, or device physics works, they'll say, well, gosh, if I achieve this temperature to stimulate collagen, if I crank it up, I'm gonna get more collagen production. But that's not what happens. You go from this window of collagen stimulation to like fat atrophy and melting fat, and that's not what you want. But you wouldn't really understand that unless you spent years looking at skin under the microscope and understanding how heat distribution and, laser physics actually works. So the temperature range in the dermis that you want to be in to help stimulate collagen and tighten skin is between 41 and 43 degrees Celsius, which is about, I think it's 106 degrees Fahrenheit. Usually we talk in terms of Celsius in medicine. So that is the kind of sweet spot in the dermis where you want to keep the heat to stimulate fibroblasts to make collagen to tighten skin. Now, the mechanism of action in which that stimulates collagen is it causes these heat shock proteins. Sometimes these heat shock proteins that are induced from high temperatures or heated up temperatures in the dermis allow the body to say, hey, there's been some type of insult and destruction to my collagen, usually collagen that's already dysfunctional and fragmented and causing fine lines and wrinkles anyway, and it stimulates your body to replace old fragmented collagen that is not functional with healthy, thick, new collagen that's going to give skin a smoother, tighter, firmer look. Now, this isn't just with Endolift. This happens with thermage, energy-based devices, usually lasers as well. But in this video, I want to concentrate on Endolift, and that is the way that Endolift works. You achieve temperatures between 41 and 43 degrees Celsius in the dermis to stimulate collagen production, and that is induced by the mechanism of action of inducing heat shock proteins in the skin and kind of disrupting the collagen that is existing in the skin by heating it up and stimulating your cells to kind of replenish the old beat up collagen with fresh, healthy, thick, new, smooth collagen fibers. Now, different providers may have different levels of training, and different devices achieve different temperatures and different temperature ranges in the skin. There's also data reports and scientific studies that suggest that there should be 3 minutes or longer of the dermis being heated up to about maintaining a temperature of 115 degrees Fahrenheit, which is actually 46 degrees Celsius. So 3 minutes or longer of having this temperature range window in the skin will stimulate collagen, as supported by the data and literature in our medical journals and at scientific meetings when we discuss energy-based devices and light-based devices for stimulation of collagen to tighten skin. Now, the opposite is true. You want to get even higher temperatures when you're melting fat. So not in areas where you want to tighten skin, but maybe in the cutaneous adipose tissue under the chin to melt the double chin, to chisel the jawline a little bit more. The temperatures that you want to achieve is 109 to 113 degrees Fahrenheit, which is 43 degrees Celsius. That's going to melt fat. Now, a lot of people are so afraid of melting fat, but then other patients want fat melted in certain areas. So in order to stimulate collagen here and melt fat here, you're going to have a higher temperature range where the fat is, but you don't want that higher temperature range where you want the more skin tightening effects of the Endolift device. Now, usually when I'm teaching medical students and derm residents, will say, but Dr. Kappel, we want to melt fat by achieving these high temperatures. Then what's the mechanism of action of cryolipolysis? Now, cryo in medicine means cold, lipo means fat, lipolysis, lysis means destruction of a cell. So when you're using cold temperatures to destroy fat cells, that also works, which is kind of counterintuitive to understand because fat cannot survive at very high temperatures or very low temperatures. Now, this is the whole mechanism behind cool sculpting. I'm not a huge cool sculpting device fan. I used it many years ago, but I feel that the side effects and the risks of the procedure for cool sculpting and cryolipolysis outweigh the benefits. So I'd rather reduce fat other ways by heating. If anything, I think Endolift would be an acceptable alternative to cryolipolysis for the adipose tissue. But it's hard for people to understand at very high temperatures or very low temperatures, fat melts. So those fat cells are very finicky. They have to exist at a certain temperature. And once the fat cells are destroyed, you can never make them again. Now, with changes in your diet and exercise regimen, the existing adipocytes, which are fat cells that you have, can get bigger or smaller. So that's why with like liposuction or Kybella or anything that's going to reduce fat, as long as you maintain a healthy or a consistent weight, you won't make more fat after it's destroyed, which is kind of a good thing. But there can be some hormonal fluctuations that can alter that. But for all intents and purposes, mainly when you destroy fat cells, they can never be made again. So your results should be long lasting. Now, there are some caveats, exceptions to that rule. But for the most part, if you freeze fat or you you melt fat or you remove fat, you're not going to make more fat cells as long as you can keep your diet and your weight consistent, because as I said, your existing fat cells can get bigger or smaller. Now, cryolipolysis is the opposite. Instead of heating up the fat or the subcutaneous tissue, we're going to decrease that temperature, and it forms almost like these ice crystals in the cytoplasm of the cell, which destroys the cell, and your immune system comes and eats it up and you excrete it away in your urine. So you're pretty much peeing out old destructed fat cells after, cryolipolysis with cool sculpting. But I wanted to mention the decrease in temperature that can also reduce fat. Although this is not the mechanism of Endolift, I know it would come up because it is kind of hard for people to understand that at high temperatures or low temperature, fat cells get destroyed. So with Endolift, the mechanism of action in decreasing fat is by heating fat cells up to a higher temperature that's going to cause destruction, which will help kind of chisel the jawline or, give you the results that you're wanting in your abdomen or, subcutaneous fat in the arms or legs or anywhere else that you want to have that targeted reduction of fat. Okay, what can you expect with the Endolift procedure? I think the benefits of the Endolift procedure is it's minimally invasive, so the downtime may be, 1 to 2 weeks of some swelling, some bruising, some redness, a little bit of discomfort, but not bad compared to surgery and some more aggressive treatments. Now, oftentimes patients will say that they are a little tender or sore or bruised from the incision site or from the numbing that was used for the procedure. And results, how long do results take to manifest, can vary patient to patient, but for the most part, you get a little bit of immediate tightening and a little bit of immediate results, but there's also long-term results as well. And long-term results from Endolift has to do with the production of new collagen. Now, that doesn't happen overnight, you guys, and I try to explain this to my patients every day when we're doing, skin tightening procedures where you're inducing your body's own regenerative processes to make collagen. So for the collagen heat shock protein mechanism to take place, for your collagen to be upregulated, to be synthesized, and for those results to present themselves takes about 2 to 3 months and typically continues to up to a year sometimes in some patients. So it's a slow process because skin is slow to respond to stimuli. It will respond, and a lot of people will say, well, if I'm over 60, am I not going to be as responsive? You still will respond. That's the great thing about skin. It's responsive to stimuli, just like the musculoskeletal system. I don't care how old you are. If you go to the gym and you lift weights and you drink your protein or you eat your protein, you're going to build muscle. So your skin is very responsive to stimuli, but it does take a moment. It's also kind of a good example, say if you've ever had like a curling iron burn or you burn yourself like on an oven. Immediately it hurts like hell, but it doesn't look any different. But then 1 week, 2 weeks, 3 weeks, a couple months later, you can have a keloidal plaque or you can have a hyperpigmented area. It takes a while for the skin to respond, but it will respond. Now, when Endolift is done, the immediate results that you get are a result from immediate cross-linking of the existing collagen. So the collagen that's in the skin gets cross-linked and actually gives an immediate response, which is nice. But the best results happen over time, and this is, weeks to months later as the production of new collagen takes place and it replaces the old dysfunctional collagen with new healthy collagen fibers that are going to help tighten and lift and smooth the skin. Now, I wanted to research the Endolift procedure for you guys, not only in our medical community, forums that aren't really accessible to the general public, and kind of take what I've learned from academic meetings, speaking with colleagues who are well-respected dermatologists in our field, and then also talking anecdotally to patients who've had this done. I do feel that Endolift works better on younger patients. If you're postmenopausal and in your 60s and you're looking for a facelift result, this is probably not the procedure for you. And I feel that those patients who do best have realistic expectations. It's not going to be magic. It's not just going to snatch up your jawline or your jowls or get rid of submental fullness like liposuction or surgery would. It's definitely not a replacement for surgery. But if you have realistic expectations and you're not asking for a lot and those expectations are appropriately managed, I think that you would be happy with the Endolift procedure. Now, a lot of people ask me why I don't have the device. I have other devices here, every device known to man, and if it's great in the space that it's in, I have it in my office. If it's not, or if suboptimal or underwhelming results, I don't have it in my office. That doesn't mean that devices I don't have in my office I don't like or I don't think work. I just think that there's ones that are a little bit better. For example, instead of Endolift, we have an Elocore. Now, Elocore is a little bit more aggressive and requires like a little bit higher level of skill and training, so you're not going to find, an Elocore on every medi spot on every corner, but in a medical practice, as a dermatology medical office, we have a little bit stronger and more aggressive treatments. So that is why I don't have an Endolift. But again, that doesn't mean that I don't think it works. I think for the right candidate, for someone who has realistic expectations and isn't looking for a magic facelift result, I think it might be a great procedure. Now, patients of mine who have had it done said that the cost typically is around, $5,000 or so. So for $5,000, you can get a lot of other procedures done, sometimes even a mini tiny little facelift. So it all just depends on, the person that you're going to, the surgeon or provider who you're going to, and also also the cost can vary greatly. We're in Orange County, and a lot of my LA-based patients say that the typical cost for Endolift is $5,000, although when I did my own research online, I found that the average cost was $1,800. So it could just vary and it could just depend. But if you're thinking about this procedure, I would shop around and see not only 1 or 2 or maybe 3 providers who do the Endolift procedure, but see these different physicians or providers, or if they're mid-levels, just make sure they have enough training in the aesthetic space to trust your precious face and body with. I think it's important to ask their level of training, how long they've been doing the procedure. Did they get the Endolift device directly from the company, or did they buy it, off market from some third-party device broker, which happens all the time, which they swap out parts, or they'll give you old refurbished devices that don't really work really well, or even worse, they can achieve temperatures that are too high or too low that can actually harm you. So when they're not regulated, it's more sketchy and it's more risky. So I always say, make sure they get the device directly from the company, they've been trained by the company, and ask to see their before and afters, and ask them to really give you realistic expectations. People overpromise, underdeliver in the med spa and aesthetic space all the time. As a medical practice, we're different than med spas. We have a different protocol, different rules and regulations on us, which help protect patients, but they don't really exist as much in the med spa mid-level space. So just really be careful with who you go to. And again, always ask to see their before and afters, not before and afters of the procedure, their own before and afters of their own patients that they treated themselves. That's really, really important. So what I've learned from, doing my research for you guys, also speaking among colleagues and patients who have had this done based on anecdotal data, patients were overall pretty pleasantly pleased with this procedure. Patients who are looking for facelift results, I think, are usually underwhelmed and dissatisfied with this procedure. But again, knowing what you're going into, having a good price point, and knowing that it's minimally invasive, usually only 1 treatment is needed. Usually there could be some immediate results, but the real results come months later if you could be patient with that. I think that's really important. Also, a lot of people have said that it has been good for like jawline contouring without the need for filler or any other tightening devices or jawline Botox, but I haven't seen a lot of people be very pleased with the collagen stimulation or collagen production aspect of it. I think defining the jawline and kind of tightening up the jowls, it has shown efficacy, but as far as like texture or stimulating collagen, people have been less than satisfied with this procedure. Now, there's other collagen texture improving devices out there that I think are better for that purpose, if you want to smooth and tighten the skin. But if you'd want to lift up on a little sagging jowls or kind of like contour the segmental area and fix a double chin, I think that it would be a treatment that I would recommend for patients, even though I don't have that device. Now, when it comes to, inner arms, abdomen, legs, I think it could be great as well. It probably, as a provider, would be not my choice, because you really don't want to reduce fat in these areas, because then you're going to get some skin laxity with it. So I think that sometimes energy-based devices or lasers that are going to tighten skin without reducing fat might be a better option. But again, everybody is different. Everybody's skin is of a different thickness. Some people have fat that they want, some people have fat that they don't want. So it just depends on, what you're looking for. But I think most importantly, the take-home message is to go to somebody who really understands the physics and how these devices work in the skin and the temperatures that they want to achieve to do what. Now, if you're going to tighten skin and reduce fat, these are 2 totally different temperature ranges. Be cognizant of where the energy is going. And I think that if you see your provider's own before and afters, that's everything. I hope this makes sense. All in all, I think Endolift is a great procedure for the right candidate who has realistic expectations. But I think that there's also a lot better options for people who are looking for skin tightening or fat reduction. But I do think that it's in our armamentarium of tools and devices in our toolbox that we have to use, for our patients for minimally invasive procedures. All right, you guys, let me know what you want to hear about next week. I was thinking about doing a video on vitamin C and just kind of a broad overview of vitamin C, hyperpigmentation, and melasma, because it's summertime. I'm getting a lot of questions as that as well, but honestly, drop a comment in the comment section. I hear you, I see you, and I want to be available to be a provider of information that's non-sponsored, so that you can make informed decisions based on science and evidence-based medicine to have the best skin at every age that you're looking for. All right, you guys, love you. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.